I remember the exact moment this stopped being just about teeth for me. It was one of those quiet mornings, the kind where the house is still and the light hasn't fully settled yet, standing in front of the mirror, brushing like I always did, going through the same motions I had gone through every single day for as long as I could remember. And yet something felt off. Not pain, nothing sharp or obvious enough to send me rushing to a doctor, just a lingering sense, subtle and persistent, like a whisper just below the threshold of hearing, that my body was trying to tell me something, and I wasn't listening. That feeling is hard to describe to someone who hasn't had it. It wasn't alarm. It wasn't even discomfort exactly. It was more like a quiet unease, the kind that settles behind your eyes and stays there even when you try to rationalize it away. And for a while, that's exactly what I did. I rationalized. I told myself I was tired, that I was overthinking, that everyone feels this way sometimes. I told myself it was nothing, but that nothing had a way of accumulating day after day until the accumulation itself became impossible to explain away. At first, it was easy to ignore, a bit of bad breath that came back no matter what I did, no matter how many times I brushed, how many mints I used, how thoroughly I rinsed. It always came back, like something was producing it from the inside out, something no amount of surface cleaning could touch. Gums that bled occasionally, but not enough to alarm me, just a faint pink in the sink. A small thing, easy to blame on brushing too hard or having sensitive tissue. Slight sensitivity when drinking something cold, that brief sharp twinge that fades almost as quickly as it arrives. All of it felt normal, or at least common enough to dismiss. The kind of things people mention offhandedly and then move on from. And for a long time, I did exactly that. I moved on. I filed it under things to keep an eye on, and then stopped watching. But over time, those small signals started to connect in a way I couldn't unsee. They started forming a pattern, one that I couldn't explain and couldn't ignore, a pattern that pointed somewhere I hadn't expected to look. It wasn't just about my mouth anymore. That was the thing that changed everything. The moment I stopped treating these signals as isolated, unrelated inconveniences and started seeing them as parts of a larger conversation my body was having with me. There were days I felt unusually tired, even after a full night's sleep, even after resting the way I was supposed to. Not the ordinary fatigue of a busy week, but something heavier, a kind of exhaustion that didn't lift with coffee or rest. My digestion felt inconsistent in ways I couldn't quite pin down. Some days fine, other days sluggish and uncomfortable for no obvious reason. Sometimes I'd wake up with a dry mouth, almost papery, and a strange heaviness in my sinuses. That pressure behind the nose and forehead that makes the world feel slightly muffled. And the unsettling part, the part that really started to get to me, was that none of these symptoms seemed directly related until I started digging deeper. Until I stopped treating each symptom as its own separate problem and started asking whether they might all be pointing to the same root cause. That's when I came across something that changed everything. The idea that the mouth isn't an isolated system. It's not just a collection of teeth and soft tissue sitting behind your lips, disconnected from everything else. It's the gateway to the entire body. Everything you breathe, everything you eat, every time you speak or swallow or simply exist, it all passes through the mouth. And more importantly, and this was the part that truly shifted my thinking, the mouth hosts one of the most complex ecosystems we have, the oral microbiome. A world inside a world. Billions of microorganisms living in a dynamic, constantly shifting balance, regulating themselves and interacting with the rest of the body in ways that science is only beginning to fully understand. And when I started learning about this ecosystem, something clicked. Something that made the whole picture suddenly make sense in a way nothing had before. What I learned next was both fascinating and, I'll admit, a little disturbing. Inside our mouths live billions of bacteria. Estimates suggest somewhere in the range of 700 different species at any given time, a population so vast and complex that it rivals almost any other microbial environment in the human body. Some of these bacteria are beneficial, essential even. They help break down food, they protect the lining of the mouth, they produce compounds that signal the immune system, they keep the more aggressive species in check. Others? Not so much. And here's the critical thing, when that balance shifts, when harmful bacteria start to dominate, when the conditions in the mouth tip in favor of the opportunistic damaging species, it doesn't just stay in the mouth. It begins to ripple outward, affecting systems we'd never think to connect. The bacteria, their byproducts, the inflammation they trigger, all of it can travel through the bloodstream, through the lymphatic system, through the simple act of swallowing. The mouth isn't a closed system. It never was. We just treated it like one. Suddenly, those small signs started to look very different. The persistent bad breath wasn't just a social inconvenience, something to manage with gum and mouthwash and a little embarrassment. It was a sign of bacterial imbalance, specifically of bacteria producing volatile sulfur compounds as metabolic byproducts, compounds with a chemical signature our noses are exquisitely sensitive to. The presence of that smell, returning again and again no matter what I did, wasn't a hygiene failure. It was information. It was the microbiome trying to communicate a disruption in its own balance. The bleeding gums weren't just from brushing too hard or having delicate tissue. They pointed to inflammation. Localized, yes, but inflammation that indicated the immune system was already engaged, already responding to bacterial activity beneath the gum line. And inflammation, as research has increasingly shown, is not something that stays neatly contained. It is one of the body's most powerful and far-reaching responses. And when it becomes chronic, when it burns low and constant instead of flaring and resolving, it has effects that extend far beyond the site where it originated. Sensitive or slightly loose teeth? That could indicate deeper structural and microbial issues below the surface, changes in the bone and tissue that support the teeth, changes driven not just by aging or genetics, but by the ongoing activity of a microbiome that had slipped out of balance. And then there was the dryness. A dry mouth isn't just uncomfortable. It's not just that sticky, unpleasant feeling on waking. Saliva is one of the body's main defenses against harmful oral bacteria. It contains antimicrobial proteins, it neutralizes acids, it physically washes away food particles and pathogens before they can establish themselves. Without adequate saliva production, the balance of the oral microbiome tilts dramatically. The bacteria that thrive in dry, acidic conditions, often the most destructive species, find the environment suddenly much more hospitable, and the bacteria that depend on the protective compounds in saliva lose their advantage. The imbalance accelerates, and when the imbalance accelerates, the ripple effects through the rest of the body become more pronounced. It was a cascade, I realized. One thing leading to another, one small disruption amplifying the next, all starting from a place I had never thought to look closely at. As I continued to explore this topic, reading the research, talking to people who had gone through similar realizations, I found something even more striking. The scientific community had been quietly documenting these connections for years, and the evidence was mounting in ways that the mainstream conversation about oral health had not yet caught up with. Research had been increasingly linking poor oral health to systemic conditions, conditions affecting not just the mouth, but the entire body, connections to digestive issues, because the bacteria in the mouth are the first populations in the long chain of the digestive microbiome. What happens in the mouth sets the stage for what happens in the gut. Connections to respiratory problems, because bacteria from the mouth can be inhaled into the lungs, especially during sleep, contributing to chronic issues that seem to have no obvious source. Connections to cardiovascular health, as studies have documented associations between chronic oral inflammation and the kind of systemic inflammation that contributes to arterial damage. Even impacts on energy levels and immune response, because a body that is constantly fighting low-grade infection and managing chronic inflammation is a body that has fewer resources available for everything else. The mouth wasn't just part of the body, it was influencing all of it, in ways both direct and indirect, in ways that most people, including me for most of my life, never thought to examine. And yet most of us are taught the same simple routine: brush, floss, rinse, brush twice a day, 2 minutes each time, don't forget to floss, maybe use a mouthwash. Important, yes, absolutely necessary as a foundation. But what if that only addresses the surface? What if the standard routine, the one we've been following since childhood, the one that feels complete and thorough, is actually only touching the top layer of the problem, like cleaning the window of a building while the foundation is slowly shifting? You can keep the glass spotless, and the structure still fails. What if the real issue was something deeper, something that no toothbrush could reach? That's when it clicked for me, fully and completely, in a way that I couldn't walk back from. I had been treating symptoms, not the cause. All this time, I had been treating the visible results of a microbiome in distress, the breath, the bleeding, the sensitivity, the dryness, without ever addressing the underlying imbalance that was producing all of those symptoms. It was like taking aspirin every day to manage a fever without ever asking why the fever kept coming back. The symptomatic relief was real, but the cause was still there, still active, still producing the same results day after day, because if the oral microbiome is out of balance, no amount of brushing alone will fix it. Brushing removes plaque. Yes, it removes food particles, it mechanically disrupts bacterial colonies on the surfaces of teeth, but it does not restore the ecological balance of the microbiome. It does not reintroduce the beneficial species that have been displaced. It does not address the conditions, the pH, the hydration, the nutrient environment, that allowed the harmful bacteria to dominate in the first place. It's like cleaning the leaves of a plant while ignoring the roots. You can make the surface look healthy while everything below it continues to deteriorate. The real transformation has to happen deeper, restoring the balance between good and bad bacteria in a way that supports the entire system, not just the parts we can see. I remember thinking about someone close to me who had gone through years of dental issues, constant visits, recurring problems, always assuming it was just part of aging, just the way their teeth were, just bad luck passed down through the family. Treatment after treatment, procedure after procedure, each one addressing the latest manifestation of the problem without ever getting to its source. But when they finally addressed the underlying inflammation and microbial imbalance, when they stopped fighting individual symptoms and started supporting the health of the ecosystem itself, something shifted, not just in their mouth, but in their overall sense of well-being. More energy in the mornings, better digestion, more regular and comfortable, fewer of those unexplained symptoms that had accumulated over the years, the heaviness, the inconsistency, the low-grade sense of being slightly unwell that had become so familiar it almost felt like their baseline. The change wasn't dramatic in the way that surgery or medication is dramatic. It was quieter than that. But it was real, and it was lasting, and it was the kind of change that made them wonder why they hadn't found this approach years earlier. That story stayed with me because it made everything feel tangible. It took it out of the realm of abstract research and put it into a human experience, one I could recognize and relate to, one that mirrored aspects of what I had been living myself. And as I started recognizing these signs more clearly in my own life and in the lives of people around me, they formed a pattern, almost like a language the body was using to communicate what it needed. A vocabulary of symptoms that, once you knew how to read it, was remarkably consistent. The breath that never truly feels fresh, no matter what you do, returning within hours of the most thorough cleaning as if it were being generated from somewhere you can't reach with a toothbrush. The gums that bleed, even slightly, even occasionally, because something beneath the surface is constantly inflamed and the tissue has become fragile. The sensitivity that slowly increases over time, creeping up so gradually that you normalize each step before you realize how far it has gone from where it started. The dry mouth in the morning, that desert feeling on waking, the mouth that should have been protected and refreshed through the night and instead feels desiccated and vulnerable. The subtle gum changes, the recession, the puffiness, the slight changes in texture and color that seem too minor to mention, but that represent real shifts in the tissue's health. The recurring sinus discomfort that you've chalked up to allergies or weather or stress for years without asking whether something else entirely might be contributing to it. The digestive irregularities that seem completely unrelated to your mouth and your teeth that you've managed with diet changes and supplements without ever considering that the microbiome feeding into your digestive system begins in your mouth. Each one of these signals, on its own, easy to dismiss. Filed under just one of those things, managed with symptomatic treatments and then largely forgotten. Together, impossible to ignore. Together they form a picture. And that picture, once you see it, changes everything about how you approach your health. And if any of this sounds familiar to you, if you recognized yourself in any part of what I just described, the returning bad breath, the gums that bleed when you brush, the morning dryness, the fatigue that doesn't respond to rest, the digestive inconsistency, the recurring sinus pressure, it might be time to look at it differently. Not with alarm, but with attention. Because these aren't random misfortunes. They're not just part of aging or just the way your body is or just bad luck. They're communications. Your body has systems designed specifically to signal when something is off, and the oral microbiome is one of the most sensitive and expressive of those systems. When it's healthy, it operates quietly in the background, doing its job, protecting and regulating and supporting everything downstream. When it's out of balance, it speaks up. And the question is whether we're listening, whether we're paying enough attention to hear what it's saying, or whether we're turning down the volume and calling the silence health. We left a practical guide in the first link in the description for you to access quickly, click and see. Because once you understand that this isn't just about oral hygiene, but about restoring balance, you start to see new possibilities open up. Possibilities that aren't about invasive procedures or endless treatments or managing a chronic condition that never quite resolves. Not the dentist's chair every few months for the same recurring problems. Not the cycle of temporary relief followed by the same symptoms returning like clockwork, but supporting the body in doing what it is actually designed to do: regulate, protect, and heal. The human body is extraordinarily capable when it has what it needs, and when the systems that are supposed to protect it are functioning the way they're meant to. The oral microbiome is one of those systems. And when you support it, when you give it the conditions to rebalance, when you stop creating the environment that allows the harmful bacteria to dominate, when you start actively cultivating the beneficial species, the effects extend far beyond the mouth. What makes this even more compelling is that science is catching up to what many have suspected and experienced for years. Studies continue to highlight how oral bacteria can influence inflammation throughout the body, how the bacteria that cause gum disease, for instance, have been found in atherosclerotic plaques, in joint tissue, in the gut microbiome, in ways that suggest their influence is far-reaching and deeply systemic. How oral inflammation correlates with markers of systemic inflammation, with immune activation, with metabolic disruption. How rebalancing this ecosystem, supporting the beneficial bacteria, reducing the conditions that favor the harmful ones, can have effects that ripple outward in ways that seem disproportionate to the simplicity of the intervention, because the mouth is upstream of almost everything. What starts there travels everywhere. That's not an exaggeration. That's biology. It changes the perspective entirely. Once you see it through this lens, you're no longer just thinking about brushing your teeth. You're no longer just trying to avoid cavities or keep your breath fresh for a few hours. You're managing a critical component of your overall health, one that influences digestion, immunity, inflammation, energy, and potentially much more. You're thinking about the mouth as a gateway, the entry point into a body that needs its first line of defense to be functioning well. And ignoring the signs that this gateway is under stress, that's not just a dental issue. It's like turning off an alarm without addressing the fire. The alarm stops making noise, but the fire continues. The symptom is managed, but the cause isn't. And eventually, what was a small, manageable imbalance becomes something larger, something more entrenched, something that affects more systems and is harder to address the longer it goes unrecognized. That realization can feel heavy at first. When you start to understand how interconnected all of this is, when you start to see the ways in which something you'd been treating as minor, a bit of bleeding here, some sensitivity there, the breath that never quite stayed fresh, might have been signaling something more significant all along, there's a natural tendency to feel a kind of regret. Why didn't I know this sooner? Why didn't someone tell me? Why was I never taught to look at it this way? And those feelings are valid. They're honest, but they don't have to be the end of the story, because that realization also opens the door to something powerful and genuinely exciting. Control, agency, the understanding that you can do something about this, that the path forward isn't just more of the same insufficient routine, but a different approach entirely, one that actually engages with the root of the problem rather than circling endlessly around its edges. Because when you know what to look for, and more importantly, what to address beneath the surface rather than just on top of it, everything starts to shift. The bad breath that keeps returning becomes something you can actually address at its source rather than just masking. The gum inflammation becomes something you can reduce from the inside rather than just treat from the outside. The fatigue and the digestive inconsistency and the recurring sinus pressure become things you watch improve as you address the root cause rather than managing each symptom in isolation. It's a different kind of engagement with your own health, more informed, more intentional, more effective. And once you experience that shift, once you feel the difference between treating symptoms and actually addressing causes, you can't go back to the old way of thinking, the old routine, the old approach, the old assumption that these small, persistent signs are just the price of living in a body. None of it holds up the same way anymore. We left a practical guide in the first link in the description for you to access quickly. Click and see. There's a method, a structured way to restore this balance from the inside out, one that works with the biology of the oral microbiome rather than against it, one that addresses the conditions that allow harmful bacteria to dominate and creates the environment in which beneficial bacteria can thrive. For those who feel stuck in a cycle of recurring dental issues, mounting expenses, constant treatments that address the manifestation without touching the cause, for those who have that persistent sense that something isn't right, that their body is trying to tell them something and they haven't been able to hear it clearly, this approach offers a completely different path forward. Not quick fixes, not temporary relief that fades when the treatment stops, not the endless cycle of symptom management, but a deeper, more sustainable solution. One that changes the underlying conditions rather than just addressing the surface, one that supports the body's own regulatory systems rather than bypassing them, one that treats the ecosystem as a whole rather than fighting individual symptoms one by one. And this is where the journey leads. Not to a place of anxiety about all the things that might be wrong, not to a spiral of worry about every symptom and sign, but to a place of understanding and clarity. A place where those warning signs are no longer ignored or explained away, but understood, where you can look at the breath that keeps returning, or the gums that bleed slightly, or the morning dryness, and know what they mean and what to do about them. A place where the mouth is no longer treated as separate from everything else, as just the home of teeth to be cleaned and preserved in isolation, but as the starting point of something much bigger, the beginning of a system that extends through the entire body, and that flourishes or struggles based in large part on what happens right there, in that gateway, in that ecosystem of billions of organisms whose balance has more influence over your overall health than most people ever learn. Because the truth is, and this is the thing I want you to hold on to, the thing that stayed with me long after I first encountered it, your body has been communicating with you all along. Not in dramatic signals that are impossible to ignore, not in the kind of obvious emergencies that force you to act, but in the quiet, persistent, easy-to-dismiss language of small symptoms that accumulate and connect and tell a story, if only you know how to read it. The bad breath that comes back, the gums that bleed, the sensitivity that grows, the dry mouth in the morning, the fatigue that doesn't lift, the digestion that feels off, the sinuses that ache for no obvious reason. Your body has been saying something. It's been patient, it's been persistent. And now, maybe for the first time, you're in a position to actually listen, not just hear the alarm, but understand what it's pointing to and take meaningful action in response to it. The question is, are you ready to listen? Are you ready to look at these signals not as minor inconveniences to be managed and forgotten, but as information, valuable, actionable, important information about the state of one of the most critical ecosystems in your body? Because once you make that shift in perspective, everything changes. The routine that felt complete suddenly reveals its gaps. The symptoms that felt unrelated suddenly reveal their connections. And the path forward, the one that actually addresses the cause rather than just suppressing the symptoms, becomes visible in a way it wasn't before. If this kind of content helps you see your health in a new way, if it opens questions you hadn't thought to ask, makes connections you hadn't seen before, gives language to things you've been experiencing without a framework to understand, make sure to subscribe to the channel. There is a lot more coming. Stories from people who went through this journey and came out the other side with a fundamentally different relationship to their health, insights from the research that is reshaping how we understand the connection between oral and systemic health, and practical discoveries that can help you reconnect with your body's signals and start taking back control one step at a time. Because this is just the beginning. And the more you understand about how your body works, how its systems communicate, how its ecosystems maintain their balance, how small upstream interventions can create large downstream changes, the more equipped you are to support it in doing what it was designed to do. That knowledge is powerful, and it starts right here,